Vaccines, there have always been people at the fringe who have been against vaccine, particularly when it comes to mass vaccination campaigns during epidemics. It's not new. For polio also, we faced a lot of opposition because of wrong information that was being peddled that the vaccine will cause infertility. And I remind them now that we are polio-free in Africa, that Africa's population, has actually almost doubled in 30 years.
Last year, Nigeria was declared polio-free by the WHO. That was a big milestone, but it took a lot to get to that point. Now we have COVID-19 with immunizing adults for the most part, and you are seeing the resistance. How are you addressing COVID-19 immunization, and what are some of the differences given that now we're talking about adults versus parents having to vaccinate their children?
Well, really, there isn't not much difference because even with children, it's adults who we have to convince to bring their children to be immunized. So the strategy is similar. One is to reach people using the voices they have trust and confidence in. So traditional leadership have come in very, very useful to us in this campaign to get people to accept. The government, with the support of partners, have been holding town hall meetings across the states in the country. They've so far been quite successful. We also use celebrities who also people know, who people also believe in. So we have these billboards, around Lagos just to get the message, across to the adult population because it is really to them that we need to appeal. Well, the rollout has gone relatively smoothly. I wish we had more vaccines because for a population of at least 200 million people, one will assume that you will have an eligible group. We're talking now of population above the age of 18, who will have at least 140 eligible people for immunization. So far, we've done only 1 million. So it's a long, long, long way to go. Right now, I'm aware of the COVAX vaccines. I also, hear that we are expecting vaccines from the African, Union, vaccine, group. Which vaccine it is, I'm not, quite sure right at the moment. So what we have in the kitty is 3 million doses left out of the 4 million we had 2 months ago.
What would you say are some of the steps to ensure that there is an effective vaccination campaign, even when it comes to not only putting the jabs in people's arm, but also myth and misinformation, tackling those as well?
I think the most important at the top of this area is advocacy. And that is one thing Rotary is very good at doing because we're everywhere. There's virtually no part of this country that are no Rotarians. So Rotarians are on ground to advocate to where it matters most, the grassroots, the traditional leadership, the religious leadership. The traditional leadership is very robust in Nigeria, right to the level, the village level. And it's the same in most parts of Africa. But of course, advocacy to the government at the central and state level is also crucial, because there need to be the political will and the resources put out there to ensure that, the amount of funding and also human resource that are required brought to bear so that the other things can follow. The next is creating public awareness. The people that you are going to vaccinate must know that if you are carrying out a campaign, we are coming to your area at such and such a time. You carry out this awareness through, again, the chain of people they have confidence in and they trust, the print media, the electronic media, social media, to get to them. The next is to make sure the funds are available. Rotary has been quite pivotal to raising the almost 21 billion US dollars that have been spent so far on the effort through advocacy with governments and also raising funds within the organization. I must give, a lot of credit to the Gates Foundation, who have been working with Rotary in the last, decade and a half. And in recent times, match every dollar Rotary spends on polio eradication with $2. The final one, as you mentioned, is that all of those three efforts will be useless if we cannot actually get to the field and ensure that we get the vaccines to the mouth of the children. And that's a huge logistic undertaking. We're talking about putting in the field 250,000 and beyond in just a small part of the country to actually go in the field and go house to house and give these vaccines to children as far as polio is concerned. So those are the 4 thematic areas, and that is what has helped us in Nigeria to get to where we're going.